Niacin's role in alcohol metabolism is a fascinating and often overlooked aspect of its biochemical significance, particularly considering how widespread alcohol use is and how significant its impact can be on liver health and systemic toxicity. At the center of this connection lies NAD, nicotinamide adenine dinucleotide, a coenzyme synthesized from niacin that is absolutely essential for the enzymatic breakdown of ethanol. Without sufficient NAD, the body cannot efficiently process alcohol, leading not only to more severe hangover symptoms, but also to a higher risk of long-term liver damage and systemic oxidative stress. When alcohol is consumed, it is primarily metabolized in the liver through a two-step enzymatic process. First, the enzyme alcohol dehydrogenase, ADH, converts ethanol into acetaldehyde, a toxic and highly reactive compound that contributes significantly to the negative effects of alcohol, including nausea, facial flushing, and headache. This reaction requires NAD as a coenzyme to accept electrons and facilitate the oxidation of ethanol. In the second step, acetaldehyde is further oxidized to acetate by the enzyme aldehyde dehydrogenase, ELDH, again requiring NAD to proceed efficiently. These two reactions consume large amounts of NAD, which must be continuously replenished to sustain detoxification, especially in cases of heavy or chronic alcohol intake. When niacin levels are low, the synthesis of NAD becomes insufficient to meet this metabolic demand. As a result, alcohol is metabolized more slowly, leading to prolonged exposure to acetaldehyde, a compound significantly more toxic than ethanol itself. This can exacerbate the symptoms of a hangover, including fatigue, brain fog, rapid heartbeat, and increased sensitivity to light and sound. More importantly, it contributes to long-term liver stress, since unprocessed acetaldehyde can form adducts with proteins and DNA, leading to inflammation, fibrosis, and eventually cirrhosis. Individuals with chronic alcohol use are at especially high risk of niacin deficiency due to both poor dietary intake and the increased nutritional demands created by repeated alcohol detoxification cycles. This interplay between niacin and alcohol metabolism has profound implications, yet it remains strikingly underrepresented in substance abuse research and clinical care. Most interventions for alcohol-related disorders focus on behavioral therapy, pharmacological craving suppression, or liver enzyme monitoring, with little attention paid to micronutrient status. In reality, restoring and maintaining adequate levels of niacin could be a foundational component of supporting liver health and cognitive function in people who consume alcohol regularly. It's not just about preventing deficiency diseases like pellagra, it's about ensuring the body has the biochemical tools it needs to safely neutralize a widely used toxin. In fact, the historical association between alcoholism and pellagra is well documented. Chronic drinkers are often among the most at-risk groups for severe niacin deficiency due to poor diet, impaired absorption, and excessive NAD depletion. Symptoms like depression, irritability, memory loss, and skin problems seen in alcoholics were once assumed to be psychological or alcohol-induced, but many of these overlap with signs of niacin deficiency. In this sense, inadequate niacin may compound the neurological and physiological effects of alcohol, creating a feedback loop of toxicity and depletion that's hard to break without direct nutritional intervention. Moreover, there's increasing evidence that NAD+ precursors like niacin could play a role in protecting the liver against oxidative damage, not just during alcohol detoxification, but in broader liver health maintenance. NADPH, a derivative of NADP, which also depends on niacin, is required for regenerating glutathione, one of the liver's most powerful antioxidants. This means that niacin indirectly contributes to neutralizing reactive oxygen species produced during ethanol metabolism. In situations where antioxidant capacity is overwhelmed, such as binge drinking or chronic alcohol use, niacin status becomes even more critical. Yet despite all of this, the role of niacin in substance abuse recovery protocols, alcohol detox regimens, or public health discussions about alcohol metabolism remains minimal. This oversight reflects a broader problem in modern medicine, the undervaluation of micronutrients in favor of pharmaceuticals, even when the biochemical pathways are well understood. We treat the symptoms of alcohol toxicity, nausea, inflammation, liver enzyme elevation, without always addressing the underlying nutrient demands created by the detox process itself. In sum, niacin is not just an energy vitamin or a cholesterol-modulating agent. It's an essential participant in a safe breakdown and elimination of ethanol. For anyone who consumes alcohol, especially in moderate to high amounts, ensuring adequate niacin intake may significantly improve resilience to hangovers, protect the liver from long-term damage, and reduce the systemic burden of alcohol toxicity. More research and public awareness are needed to restore niacin to its rightful place in the conversation about liver health and alcohol metabolism, where its contributions have long been undervalued and misunderstood.